Coronavirus, in the majority of cases, over 80% we know will cause a very mild type of infection. What does that mean? Well, respiratory symptoms like a low-grade fever, 100.4 or more, a cough, some shortness of breath, a runny nose. More than 80% of people who come in contact with this virus will have that occur. And they will recover from it, and they'll go on their way. Where we have concerns are in patients who have underlying chronic diseases, who may be immunocompromised, and that's a medical term to just say they're more vulnerable to infection. Maybe their white blood cell count, which is a mechanism by which the body fights infection, may be low. Patients who already have underlying respiratory problems or issues. The elderly, the very old, possibly the very young, may be a cause for concern, but those are the individuals that are more likely to have problems with it. Why is it a concern to us? Because right now we have a test, happily, that we can use to make a diagnosis, but there is no vaccination available for it at this time, and there's no specific medication to treat it. So we, as healthcare professionals, would give supportive care to the individual until they recover. So you're such an important part of the solution and such an important role that you play in its containment of this infection. So what are we asking you to do? Those simple things that you've heard about all along. We're asking you to wash your hands. And we mean really wash your hands. 20-second scrub is what we ask for. And if you can't figure out 20 seconds easily, sing happy birthday to yourself twice in your mind. That is about 20 seconds. If you cannot immediately wash your hands with soap and water, use alcohol, foam, or gel. That's completely appropriate. Get it on your hands, in between your fingers, under your nails, and let it dry. We're also asking you to do good respiratory etiquette, which should be nothing new to you. Cover your cough. Cover your sneeze. If you sneeze into a tissue. Then do hand hygiene right after. But we're also asking you to stay away from what I like to call sneezy people. If they're sneezing or coughing, keep your distance. And that's what we would do in any flu season anyway. At least 6 feet away from the individual who's sick. We call it social distancing. If you yourself are sick or exhibiting symptoms or signs of respiratory infection or illness, you really should refrain from visiting our facility, or actually any facility in general, because the patients that are there cannot afford to get sick. What does this mean? Well, it might be a little daunting for you to consider that you have a loved one in a facility and you're not readily able to visit or see them. But in this modern age with social media, there are ways that you can stay in contact with them so that they know that you are there and you know that they are safe. Easily call, see how they are doing. You can text. You can contact them by email. There are ways that you can stay in contact and let them know that you are still thinking about them without having to come into a hospital setting. And not just our own hospital setting, but you will see around the state that everyone is taking preemptive protective measures to prevent illness in the very young, the very old, those, as I mentioned, that are immunocompromised, those individuals who have underlying medical conditions from which they are already sick. It's part of playing it safe and helping us in keeping them safe overall. We at Hospital for Special Care have been looking at this situation for quite a long time, and we've prepared in advance of the infection coming to Connecticut so that we can care for our patient population, keep our employees safe, and have good outcomes all around. Knowledge is power. When you have it, you are powerful. And as I like to think and say, panic and fear spreads a lot faster than this virus ever will. So please join us in being a partner as we provide care to our patients and we work hard to keep our environment safe. Thank you for your cooperation.